Hi, welcome to Mad Medicine with Miss P. I got quite a few things today. Still going to try to keep it at 15, but we may go over. We'll see. Okay, so a couple little things. I looked dark in this corner earlier, so I don't know. Does that look normal? Does it matter? Probably not. Okay, so I got some interesting stuff this week alone. Um, pretty tricky, and you're not quite sure how to respond to some stuff. I got to try to figure out where we left off. Yes, last time. So this week, or even last week. Oh, this one was the one from last week that I forgot. As this patient, I said, okay, and what medication do you take regularly? And she's not the only one that said this, but they said, do you want my whole list? Yes, you can pick and choose, but there's a good chance the anesthesiologist is going to need to know all of the medications you take. My whole list. Um, my favorites, this happens a lot. This is just an example. As they're giving you their meds, they're trying to tell you what they're for or what they think they're for. Sometimes they're right, but a lot of times they're not. I take atorvastatin for blood pressure. Okay, are you saying atorvastatin? Okay, that's for cholesterol. How much and how often? And they're like 180 milligrams. Nope, you're thinking of a different medication that usually only comes like 5, 10, 20, 40, 80 is the most I've ever seen. And if you're taking 180, you may need to see different doctors. This was one of my favorite I got last week. Under their surgeries now, they're putting their own information in now, and I don't know which is worse, having to call each individual patient and get their entire history, and at least you can decipher it and chart it correctly, or letting them write it down, because this person put down in their history of surgeries, heart surgery. They had heart surgery. I'm sorry, sir. Can you be more vague? I think the only thing that could have been more vague is if they said chest surgery, but heart surgery. I said, okay, well, did you have a bypass, a valve replacement, a transplant? Can you stent? Can you give me an idea of what kind of heart surgery? Yeah, he had a triple bypass. I just left it off on everything else. Just skipped all the other stuff. Didn't put in that he has a cardiologist or anything after his heart surgery. This was an interesting one. And I love when my coworker's listening to me, or I have to listen to her decipher, what could be going on the other line, because this person told me that she just found out at 65 years old that she has a PFO. I said, oh, okay. Well, are you having any issues or symptoms from it or anything like that? And she's like, no, not really. I said, okay. So what cardiologist are you seeing for your patent foraminal And she's like, oh, I don't know. What's that? So what's what? What's that thing you just said I have? I said a patent foramen ovale. Yeah, what's that? Oh, that's the thing you just told me you had. You told me you had a PFO, correct? And she said yes. So well, what's PFO stand for? She said I don't know. This is a 65-year-old adult who I'm assuming has made some sort of life for herself. She's maybe reproduced, possibly raised a family. I'm assuming she can drive. And the doctor told her she had a PFO, and she's never attempted to look it up, find out what those letters stand for, or what it actually is, what it means. What that structure of her heart is. I'm not making this up. This is straight up real. I'm not even exaggerating. This is literally what happened. And then of course they always say like, I'll say how many. I say, okay, I see that you've never had surgery before, because they left it open. Oh no, it's too many to mention. Okay, that's the reason. Like that's all the more reason we need to know. What would not be worth mentioning is like if you had your wisdom teeth removed when you were 19 and you're 75 and you've never had surgery since. Like that is like not even worth talking about. Like we literally don't even know how you would respond to anesthesia since you haven't had it in like 60 years. Like that would be worth talking about. But if you've had so many surgeries that you feel it's too much to type, that's all the more reason that we need to know that. And I know all of you nurses are feeling me. Or they say, I'm talking to like a 68-year-old lady. She's like, "Oh my God, how far you want to go back?" Birth. I literally said, "What surgery have you had in your life?" That means your life and when it started back at birth. That's what I want to know. Um, Oh, I love when, patients think that they've had like, they don't know they always ask about anesthesia. "What kind of anesthesia am I getting?" "Or you're getting a general anesthetic." "Oh, okay." They don't know what that means, and this is how I know. The amount of patients that write down in the surgical history, they write the name of the surgery, what year, if they can remember, roundabout, and then what kind of anesthesia they had. Was this under local? And if you see local, 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 you're like, okay, yes, those are surgeries. You cut and sew, those are surgeries. But if they're under local, it doesn't give us an idea of how you tolerate anesthesia. So, we're kind of starting from scratch. Or, we see you've had general, 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 general. Okay, well, obviously you survived it. So, and then how you feel with general anesthesia. And you can let us know, do you get nauseated? Do we need to do something about it? And, we're prepared for that. So when patients think that they had a total shoulder replacement under sedation, maybe it's possible. I mean, I guess it's entirely possible. I don't think so, but I don't want to be in that surgery. Here's one of my favorites. I saw this yesterday, and thank God I didn't have to call this patient. My coworker did, and it actually was fine, and she was a nice lady, and everything went well. But under allergy, here's another thing. You know how I feel about allergies. Y'all who know me, you know how I feel about blood thinner. It hurts. Oh God, it hurts to say that. I'm okay though. I'm okay. And allergies, the things people think they're allergic to, and the things that they're not remotely allergic to. In fact, my coworker sent me this Instagram little meme, and it's Marge, not Marge. What's a little Simpson girl? Oh my gosh, I'm blanking on her name. Marge's daughter. Anyway, it says, like, knock it off, Karen. You're not allergic to 30 things. Nobody can be, and stop being such a bee. I just thought it was so cute and so true. Now it's going to bother me that I can't remember her name. Bart and y'all are shouting it, I'm sure. I'm blanking on the little girl's name. It's killing me. I'll shout it out on my drive into town today. Anyway, so this lady, you write in the name of the drug or the name of the thing you're allergic to. And they always want to tell us how they're allergic to gluten and bee stings and all that. And, in their defense, it does say, mention all that stuff. I don't know why it says that. I would love to erase that. We cannot administer gluten to you. We cannot administer bee stings to you. We can't give you the tetanus toxoid or anything like that. But it says, tell us what you're allergic to. So in their defense, you write in the name of the allergy, whatever it is you're allergic to. And then underneath that, you're supposed to put in your response. Did you turn red, itch, swell, or all the other crap we don't care about, And not that some of that, means we're going to give it to you anyway. Of course we're not. But if it makes you super sleepy or hallucinate or deathly ill or nausea or pass out and all the other stuff, oh, okay, we're not going to give it to you. But an allergy is what we're worried about, making sure that we don't give you something that makes you feel crappy afterwards versus that could kill you. There's a big difference, right? So under the allergy little opening, she wrote drugs. She wrote the word drugs, drugs. She wrote drugs. She's allergic to drugs. I wonder if she's married to the guy who had heart surgery. They're both so vague. And then, of course, when my coworker called her, she got to the bottom of it. We know exactly what she's allergic to. But these are the things that I don't. They're not stupid people. Like when you talk to them, they for the most part got it together. And you don't have to be a doctor or a nurse. Clearly, though, that's not going to help things. Just writing drugs in there. Maybe she put that in there to like remind her to talk to the nurse about it when we call. I don't know. Drugs. Same lady. I think this was the same lady. Maybe not. Doesn't matter. Under surgery, she put right explorative surgery. Right explorative surgery. First of all, I don't think that's a word. I'm sure she meant exploratory, but the right side of what? What could they have explored that was on your right side? If it's like abdominal or pelvic, or they'll say like, I had a laparoscopic surgery. Like, okay, that's It's just using the scope. You're still going to have to, tell us something else. What part of your body were they in with said scope? And when you hear lap, you think abdomen, and that's what it refers to for the most part. But still, for why? What did they find? What did they do? Did they biopsy? What was the issue? Right explorative surgery. Now, never got to call that one. I'm very curious what that is. And I think this was the same person who said she had under surgery. She simply wrote this non-word. You know what? I know what it is now. I exactly know what it is now. Okay, so this is what she wrote. And it just dawned on me. I know exactly what she wrote. Still not a surgery, but I'm going to bet because that freaking A is so close to the S, that's exactly what she wrote. Still not a surgery. That is a part of your body. That is just your anatomy. But that just dawned on me. That's exactly what she wrote. I don't know why I didn't get that earlier. Still, when you say like tonsils, that's just your anatomy. Adenoids, that's your anatomy. I love when they write hernia. Okay, that's still just a problem. It's not the name of the surgery, but I see where you're going. Speaking of hernia, this gentleman wrote that he was having a hernia in his groin area. That's where one groans. The area he was having his surgery was in the groin area. I know what he meant. And I talked to him. Pleasant fellow. Every question I asked him, he responded with, yeah, I put it all in there. And that questionnaire y'all sent me, that's all in there. It's not, because you also, when asked, you checked you had a hiatal hernia and yet weren't on any medications or had mentioned anything. And he thought that a hiatal hernia was the same as an inguinal hernia. So when you're rushing me off the phone and basically telling me that you put all that information in there so there's no reason for us to talk, you need to know what you're talking about, because hiatal hernia, inguinal hernia, not the same thing, not even a little. And then suddenly he had all kinds of questions when he realized that he was not remotely close to understanding what he was trying to say. Okay, so I think I left off with the PEG 2 placement with TPN. Okay, so a couple more here, and then I got to get out of here. Here's one that was started. Now, these are all students. I think most of these are students, so saddle up, y'all, because you know exactly who you are. And don't give yourselves away. Don't say anything in the comments. Not that anybody ever comments, which is fine, because I don't have time to read all that anyway. But just whoever wrote this was a long time ago. Right extremity strength weak on neurocheck. I guess I see what you're saying, but that's not how it's charted. Right extremity strength. I guess that's both extremities, or maybe the upper and just the lower. Not sure how that neurocheck is going exactly, because we're leaving some stuff out, but that's okay. Patient had Zantac to keep her calm. Yeah, you know how a little H2 inhibitor can relax you. A little H2 antagonist just kind of takes the edge off of things. Are you upset? Let me get you some Pepcid. Are you worried about that upcoming situation? Let me see if I have some Protonics for you. Oh yes, this student wrote in, started it off with old male patient. Now I'm going to bet she wanted to write in like how many years old, but that's not what it said. It said old male patient. That's good to know. Equal grasps in arms. That's what it says. Equal grasps in arms. I guess she's saying if you can carry a pen in your elbow, like in your, I don't know, your little antecubital site. And grasps, I never understood that. Some instructors say grasp. A grasp is like you're grasping at straws, you're trying to grab one. I'm putting my fingers inside your hand. That's a grip. I want to see if you can grip my hand, not grasp at it like I'm, almost got to be quicker than that. It's not $1 on a string. Heart sounds clear throughout. Throughout what? If you're hearing heart sounds throughout the body, if If you're listening to bowel sounds, you can steal a heart. You listen, you know what? And some are that strong and hard. I have heard bowel sounds when listening to the heart, and I've heard some heart sounds-ish listening to bowels, depending on how hard we're thumping there and how much emptiness is going on. It, could echo, but I still, that's not, we don't chart it like that. That's good stuff though. Skin is clear throughout. She's got some nice clear skin. That's good. Okay. I'm assuming maybe a dermatologist wrote this. Nope, that was a student. Good stuff. Aortic fibrillation. Aortic fibrillation. Now, that sounds dangerous. If your aorta is fibrillating, that could be a problem. And I'm not sure how one diagnoses that. Maybe you were in the heart center and the doctor told you the aorta was fibrillating. It's fibrillating. Cast on left arm to mid-femoral covering fingers due to distal humerus fracture. Does anybody want to go be a nursing instructor right about now? You can't make this stuff up. You can't. Like this is literally what a student charted. What do you do with that? How do you're like, Ashley, can I talk to you for a second? Can you come here for a second? I just want to clarify something with you. What the crap are you talking about? But you can't say that. And yes, maybe I have from time to time, but shh, don't tell anybody. Okay, let me just do this little history of CAB, C-A-B. Think they took a cab once? I told you about it. Writing it down as a history. I don't know. Sinus rhythm at 54. Nope. Sinus rhythm at 112. Nope. That's Brady and that's tacky. You can say sinus Brady at 54. You can say sinus tack at 112. Know the difference. 25 liters per minute at non-rebreather. Sort of. It's not really how it's charted, but all right. Okay. Left upper umbilicus. Okay. How many belly buttons does this guy have? Left upper umbilicus. That's what it said, you guys. You can't make it up. Okay. So that's that. I'm stopping here. We'll come back with, oh, that's a good one. We'll come back with the next interesting little chart. So that's it. I got to get out of here. Have a lovely day. Same as always. Oh, and guess what? So sad. I'm over 100 subscribers. That's right. 100 people watch this crap. No, it gets better though. Not 100,000, just 100. And that was kind of what I was shooting for, more or less. And I still can't believe that many people would even watch this. I bet if it was shorter, more would watch, because look, I'm already at 18. Okay. Forget your failures, face your fears, follow your faith. I love y'all. And I'll see you next time. If there is a next time. I stole that from Andrew. I probably shouldn't say that. Can I get in trouble for saying that? You know what if I turn it off and back on? See if that works. You know what? Forget it. I don't care. I got to get out of here. Like always, I have 400 things to do today.